Chairman Miller, Ranking Member Klein, and members of the committee, it is indeed an honor to be with you today to discuss the economics of healthcare reform. The President, as you know, has identified comprehensive, meaningful healthcare reform as a top priority, and the administration is grateful to the Congress for working so quickly and tirelessly on this important issue. In my remarks today, I will discuss the economic imperative of reform that satisfies the President's dual goals of slowing the growth rate of healthcare costs significantly and providing quality, affordable health insurance coverage for all Americans. The figures in the analysis that underlie my testimony today are contained in the Council of Economic Advisors report, The Economic Case for Healthcare Reform. With your permission, I would like to include a copy of that report in my testimony so that the sources and methodology are fully documented for the committee. Well, many of the crucial trends in American healthcare are well known, but the Council of Economic Advisors worked with others in the administration to develop projections of what will happen in the absence of reform. Spelling out these facts and trends makes a compelling case that the status quo is simply not an option. Now, one key fact is that healthcare expenditures in the United States are about 18% of GDP, by far the highest of any country. And if we can go to the first figure, this figure shows our projections of the likely path of national healthcare expenditures. These expenditures are projected to rise sharply. By 2040, health expenditures could be roughly 1/3 of total output in the U.S. economy. All right, how about for households? Well, for households, rising healthcare expenditures will likely show up in rising insurance premiums. Even if employers continue to pay the lion's share of premiums, both economic theory and empirical evidence suggest that this trend will show up in stagnating take-home wages. This next figure shows our projections of total compensation and compensation less insurance costs, both in inflation-adjusted dollars. The wedge-shaped area between the two lines shows our predicted level of insurance premiums. What you see is that without reform, the non-insurance part of compensation will grow very slowly and will likely fall eventually as premiums rise rapidly. All right, rising health care costs also mean that government spending on Medicare and Medicaid will rise sharply over time. We go to the next figure. This picture, the dashed line shows the projected path of combined federal and state spending on Medicare and Medicaid. Our projections show that these expenditures, which are currently about 6% of GDP, will rise to 15% of GDP by 2040. In the absence of tremendous increases in taxes or reductions in other types of government spending, this trend implies a devastating and frankly unsustainable rise in the federal budget deficit. Another trend that is too crucial to be ignored is the rise in the number of Americans without health insurance. Currently, 46 million people in the United States are uninsured. In the absence of reform, if we look at the next picture, this number is projected to rise to about 72 million in 2040, an increase of 26 million people over the next 30 years. Well, the President has emphasized that providing quality, affordable health insurance for all Americans is a key goal of reform. For the many Americans who currently have health insurance, as has been noted here this morning, the President has promised that if you like your doctor and your existing plan, you can keep them. The President and Congress are also proposing methods to make the existing system work better for all families, such as simplification of insurance forms and electronic health records that reduce duplication of tests and prevent medical errors. For the millions of Americans without insurance, the President is committed to working with Congress to design a sensible, cost-effective method of coverage expansion. Expanding coverage will likely involve the creation of a health insurance exchange that gives individuals and small groups the same benefits of risk pooling and elimination of adverse selection that employees of large firms enjoy. One feature of health reform that the President has emphasized is that no one should be denied health coverage due to pre-existing conditions. Americans with health problems need the security of knowing that if they change jobs or lose their job, they will still be able to get health insurance coverage. Now, there are important benefits to the economy and to society of coverage expansion. The most important of these involves the health and economic well-being of the uninsured. In our report, we use the best available estimates to try to quantify the costs and benefits of expanding coverage to all Americans. Among the benefits that we attempt to put a dollar value on are the increase in life expectancy, the improvement in health, and the decreased risk of financial ruin from high medical bills. We find the benefits of expanding coverage to the uninsured are very large and substantially greater than the costs. Our estimates show that the net benefits, the benefits minus the costs, are roughly $100 billion per year, or about 2/3% of GDP. Another effect of expanding coverage is increased labor supply. With expanded coverage, some people who'd not be able to work because of disability would be able to get health care that prevents or effectively treats the disability. They would therefore be able to stay in the labor force. Similarly, some workers currently in the labor force would be more productive if they had health care. We believe that the net impact on effective labor supply will be positive and will increase GDP. Expanding coverage will also improve the efficiency of the labor market. Creating an insurance exchange and eliminating restrictions on pre-existing conditions would end the phenomenon of job lock, where worries about health insurance cause workers to stay in jobs even when better ones are available. Our estimates are that this benefit could be about 0.2% of GDP each year. Similarly, we examine the fact that small businesses are disadvantaged in the labor market because current employer-sponsored insurance is so expensive for them. Moving to a system that removes that disadvantage could be beneficial to the competitiveness of the important small business sector of the economy. Now, while the benefits of expanding coverage are substantial, slowing the growth rate of health care costs is essential to moving the economy off its unsustainable path and securing a better economic future for the American people. And in discussing cost containment, I want to focus on the slowing of the growth rate of costs. This is the so-called curve bending that can last for decades. Slowing cost growth is quite separate from the actions we might take immediately to cut the level of government medical spending. These immediate reductions are crucial for paying for the expansion of coverage and other health care reforms in the short run. But for thinking about the changes that will save us from the unsustainable long-run trends, slowing cost growth year after year is essential. Now, many meaningful reforms are necessary to slow the growth rate of costs over time. The CEA report focused on the conceptual importance of reforms rather than the mechanics, but the report does describe in broad terms the kind of changes that might be implemented. We discuss, for example, changes in payment systems, such as bundling of payments for hospital and post-hospital care, and change in the organization of care delivery, such as the formation of accountable care organizations and medical homes, as ways to reduce fragmentation and promote more effective and more efficient care. We emphasize the crucial role that investments in health information technology and research on what works and what doesn't could play in reining in cost growth. The President, in his speech last week to the American Medical Association, made some specific suggestions for reforms along the lines that I've described. He also said that he was open to changes that would give the recommendations of the Medicare Payment Advisory Commission greater chance of adoption and implementation. The Congressional Budget Office has also outlined a large number of game-changing reforms that experts believe could slow cost growth. In our report, we speak of the benefits of slowing the growth rate of health care costs, but each of our figures implicitly shows the impact of not slowing cost growth. To help emphasize the importance of doing reform well, I will describe them from that perspective this morning. Fundamentally, what slowing cost growth does is to free up resources. If we restrain costs by eliminating waste and inefficiency, we can have the same real amount of health care with resources left over to produce the other things that we value. This causes standards of living to be higher. In our analysis, we consider varying degrees of cost containment. In particular, we look at the effect of slowing the annual growth rate of health care costs by 1.5, 1, and just 0.5 percentage point. We analyze the effects of freeing up resources in a standard growth accounting framework. Our framework includes the effect of slowing cost growth on the deficit and capital formation or investment. All right, well, if we go to the next figure, This figure shows the crucial importance of slowing cost growth for standards of living. To make these numbers more concrete, we translate them into the effects on the income for a typical family of 4, again in constant inflation-adjusted dollars. The bottom line shows the projected path of real family income without reform. The higher paths show family income under different degrees of cost containment. Our numbers suggest that failing to slow cost growth results in substantially lower standards of living for American families. Without reform, our analysis predicts that the typical family income in 2020 will be roughly $2,600 lower than it would be if we managed to slow the growth rate of costs by 1.5 percentage points. By 2030, it will be nearly $10,000 lower than if we managed to slow cost growth. Failing to control the growth of health care costs will condemn American families to much lower standards of living than they would experience with successful reform. Slowing the growth of health care costs will also have enormous effects on the budget deficit. This last figure shows the reduction in, shows the reduction in the federal budget deficit due to different degrees of cost containment. Consider the numbers in the middle for 2030. They show that slowing the growth rate of health care costs by 1.5 percentage points will reduce the deficit by 3% of GDP. Put another way, failing to slow cost growth by 1.5 percentage points per year will result in a deficit that is higher by 3% of GDP. By not slowing costs, we will leave our children a budget deficit in 2040 that is 6% of GDP higher than it would have been with successful reform. The numbers illustrate the crucial truth that serious health care cost growth containment is central to our long-run fiscal stability. Taken together, the analysis by the Council of Economic Advisors shows that doing nothing on health care reform is simply not an option. Expanding coverage will unquestionably have benefits for economic well-being, the efficiency of the labor market, and the competitiveness of small businesses. But only by undertaking meaningful reforms to slow the growth of health care costs can we assure American families of rising standards of living and falling rather than ever-increasing budget deficits. The President has spoken frequently of the need to provide the American economy with a new foundation. His goal is that we not only come through the current economic crisis, but emerge a stronger, more durable economy. Health care reform that provides quality, affordable coverage for all Americans and genuinely slows the growth rate of costs significantly is a crucial part of that new foundation. Successful reform is fundamental to the long-run health of the American economy. Thank you.